Hello and welcome back to your therapy guide. I'm Dr. Yadegarfard. Today we are going to talk about a question I hear all the time. Should I take medication for my mental health? It's a question filled with mixed emotions, fear, hope, and sometimes even guilt. So if you ever wondered whether antidepressant or other medication could help you, you're absolutely not alone. In this episode, we'll explore what taking medication really means for your recovery, when it might help, what it can and can't do, and how to make informed, empowered decisions alongside your GP or psychiatrist. Let's start with the basics. Mental health difficulties like depression and anxiety don't just live in your thoughts. They also involve changes in the brain's chemistry and function. Antidepressant medication works by helping to rebalance neurotransmitters, the brain chemicals that influence mood, motivation, and focus. Think of it like restoring communication in a system that has been disrupted by long-term stress or emotional overload. For some people, this rebalancing effect creates just enough stability to make therapy, self-care, and daily functioning possible again. Medication can help lift the fog, reduce anxiety's intensity, and allow your brain to engage more fully in recovery work. So medication is not about fixing you, it's about giving your mind a steadier foundation from which to heal. Taking medication for mental health is rarely a purely medical decision. It's also deeply emotional. Many people worry, does this mean I'm weak? Will I have to take it forever? Will it change who I am? These are very human fears. Here's the truth. Taking medication is not a sign of weakness. It is a sign that you're taking your health seriously, just as you would if you had diabetes or high blood pressure. And no, medication does not change your personality. When it works well, it helps you feel more like yourself again. It does not erase your emotion or your identity. It simply reduces the intensity of distress that has been holding you back. Medication on its own can help, but is often most effective alongside therapy. Therapy helps you understand the root causes, your thoughts, patterns, and emotions, while medication helps regulate the biological systems that support that work. I often describe it this way. If therapy gives you the tools to rebuild your house, medication helps calm the storm long enough for you to do the work safely. One doesn't replace the other. They work hand in hand. There is no single rule for when to start medication, but here are a few times when it might be worth discussing with your GP or therapist. When symptoms like depression or anxiety persist for several weeks or months. When your daily life, sleep, work, relationships are being constantly affected. When you've tried therapy, lifestyle changes, or coping strategy but still feel stuck. Here is a simple way to bring it up with your GP or therapist. You might say, I've been working hard on my recovery, but I still feel stuck. Do you think medication could help me right now? Or, I'm wondering if adding medication could make it easier to manage my symptoms while I continue therapy. You don't have to commit to anything. You're just starting a conversation. Every medication has potential benefits and possible side effects. It's okay and important to ask your GP or psychiatrist about both. You might say, what should I expect in the first few weeks? How long before I notice any changes? What side effects should I watch for, and what should I do if they happen? Most antidepressants take 2 to 6 weeks to show noticeable effects. During that time, you might feel subtle changes. First, better sleep, slightly more energy, or fewer emotional crashes. Those small shifts can become stepping stones toward stability. Medication decisions work best when you see them as a collaboration between you and your healthcare provider. You can say things like, "I'd like to understand how this medication fits into my overall recovery plan. Can we review it together in a few weeks to see if it's helping?" Keep a brief record of your mood, sleep, and energy levels. Helps your doctor track progress and make any needed adjustments. Remember, you have a voice in this process. It is important to remember that medication isn't about changing who you are, it's about supporting your recovery. Think of it as a bridge, something that helps you cross from a place of survival to a place of stability. You don't have to see it as a forever decision. You can see it as one of many tools available to help you heal. Let's talk about what happened after you start medication. If you decided to start, be patient and kind with yourself. The first few weeks can feel uncertain as your body adjusts. Stay in contact with your GP or psychiatrist, especially if you notice any strong side effects or mood changes. And keep using your therapy tools like journaling, grounding, self-care, exercise, because medication supports your emotional work, it doesn't replace it. If things feel confusing, it's okay to ask, is this how I'm supposed to feel? Can we adjust the dose or try a different option? Taking medication toward recovery doesn't mean you're weak. It means you're taking active steps to feel better. It's one part of a bigger holistic approach that includes therapy, lifestyle changes, and compassion for yourself. If you're considering medication right now, take your time, ask questions, and trust that you're doing something brave. Every person's path to recovery looks different, and that's okay. Thank you for joining me today on your therapy guide. If this episode helped you understand your options better, please share it with someone who might benefit. Don't forget to subscribe and follow me on social media. All the links are in the show notes. Until next time, take care of yourself, and remember, healing is never one size fits all. It's about finding what works best for you. See you in the next episode.